Hi everyone, welcome back to the channel. This is Nursing Practice Made Easy. My name is Patrick. I'll be your RN today. This video today is continuing on the nursing process. Be sure to check out video number 1 and video number 2. Video number 1 talking about the assessment component of the nursing process. Video number 2 talking about the diagnosis. So now we are doing continuing on the nursing process. So in this video, we will be talking about the P in ADPI. You know, ADPI, the 5 components of the nursing process. Of course, the A is assessment, the D, diagnosis, and the P, planning, and I, implementing, and the E is evaluating. So today we're going to be talking about the P, which is the planning. All right, so we were talking about our goals and our outcome because that's what the P is. All right, so be sure to subscribe to the channel, leave a comment, click the like button, be sure to share it with others. All right, this is Nursing Practice Made Easy, where it is broken down simply so that everyone can understand it. So if you're a first year, second, third year nursing student, if you're in the ADN program, you're in a bachelor's program, a master's program, all right, this content is for you. All right, Nursing Practice Made Easy. So in our last 2 videos on the nursing process, so we talked about the diagnosing, and now we want to look at planning, all right, which is what the P is for in ADPI. And planning is, of course, the goals and the outcome. That's what that planning is all about. So when the nursing diagnosis, of course, that is defining the problem, and that problem speaks to the human response to an actual or a potential problem, and how the nurse cares for it, and the type of interventions that the nurse will come up with, and those interventions will be what the nurse is responsible for. All right, so you know, the nursing process is cyclic, it's dynamic. You know, you can't do with one component, you cannot do without the other components. So for it to be a complete process, all components have to be involved, and for you to come up with a very good care plan, all the components have to be involved. So planning is what we'll be talking about. So in talking about planning, I'm going to be looking at, you know, goals and outcome. What are the what the goals and the outcome consist of, and we're going to be talking about a SMART goal. All right, we're going to be talking about making the goal really smart. All right, so we're talking about that, and also we will be looking at how this planning fits into other aspects of nursing care. So we're going to be looking at how the in-service educator uses the P, which is plan, setting goals, how the educator, whether you're in school or you're a clinical instructor or a preceptor, or you are in the lab doing clinical or precepting. So all of this also goes for you as well. And also we're going to be looking how we use this P in the management process. You know that, of course, we can use this P as in planning, as in setting goals and outcome in management. And that management will be looking at you know, the nurse manager, or if you are the charge nurse on the unit for that particular day. How does the P in ADPI, which is planning, setting goals and outcome, how do you use that as a manager when it comes on to the units, and of course getting you know, the work done? So all of that we'll be talking about in this video. All right, so stay tuned. Don't forget to click the subscribe button, comment, share, like it, of course, so that others can get the information as well. All right, so Nursing Practice Made Easy, this is your channel. So we're going to be talking about making a SMART goal. Okay, so the goal, all right, or the outcome, that's what the planning is all about. And this P in ADPI is equal to the P in SOAPI. You know, SOAPI, which is the documentation method that we use. So that P in ADPI is equal to that P in SOAPI. All right, so it's the same thing that we're talking about goal, and we're talking about outcome. All right, so now when you write this P in your SOAP, as in your documentation, in your chart, whether it is your electronic chart or computer, remember that this P now is not an implementation. All right, so you're not going to write your plan that you will administer oxygen, put the patient in a semi-Fowler's position. Those are all implementation. But what you want is the patient to improve oxygenation, improve nutrition. Those are outcomes, those are goals, and that's what the plan should be and what the plan should be stating. All right, so a smart way to always remember that the goal is always going to state a part of the problem, and usually the first part of the problem, the goal will be it will be set in that first part of the problem. So when we state a goal, we're really always going to see the goal reflecting the problem, because the goal usually speaks to a piece of that problem. So for example, the scenario that we use in videos 1 and 2 on the nursing process, we're talking about the client that had coronary artery disease, was having chest pain, and so the diagnosis was ineffective myocardial tissue perfusion. So now the goal is going to state part of the problem or reflect part of the problem. All right, so the goal will mention a piece of the problem or sometimes the entire problem, just that it's specific to what the outcome will be or what it is that we want to achieve. So when you write your goals, you're always going to find that a piece of that problem is reflected in the goal, and rightly so, because the goal or the outcome that we are writing, what we will implement is really to get that goal achieved, and so we will implement the things on that. So the goal is going to be written based on the problem that we came up with, which is the diagnosis, or problems that we came up with, which are the diagnoses. Okay, and so therefore, when we talk about a goal, what are the things that makes a good goal? All right, so always remember SMART. You make a SMART goal. All right, so the S here, okay, this S is the goal specific. All right, so we talk about specific, we want it to be specific. All right, so that's what we're looking at. So the S stands for specific. What's specific? We want to make sure that what we are saying is specific, pointing to what the problem is, and it's specific to the person or the thing that we're referring to. All right, so specificity is pointing to the problem, and the specificity is also pointing to the person, the family, or the group, as in the members of the community. All right, so it's specific to the individual, the family, and the community. All right, so let's say, for example, we're talking about this ineffective myocardial tissue perfusion, and our specificity is that the patient will have improved myocardial tissue perfusion. So see, two specific things mentioned: the client, so that is who the goal is aimed towards, and the problem, which is the myocardial tissue perfusion, that's also what is aimed towards. So you want to make sure your goal is SMART. So the S is for specific. We want the goal to be very specific, and then we also want it to be measurable. All right, so that's what our M is for. It's measurable. So we want to be able to measure this. All right, something that can be measured. All right, so measure. Okay, so measure. So measurable. It means, therefore, that the goal must be written so that there must be something there that can give a measurement to determine whether or not it met what it was intended, or it did not meet it. All right, so let's say the same patient that we're talking about, and the patient was complaining of chest pain, which the patient gave a rating as an 8 out of 10. So the diagnosis was altered comfort acute pain. All right, and that's related to deficient oxygen supply to myocardium or heart muscle, and that's really where the pain came from. So if we are writing a goal for that to measure, we want to say that specifically at the end of 45 minutes or the end of 15 minutes, because we're talking about the myocardium now, so we need to reestablish oxygen and blood flow as quickly as possible. All right, so let's say by the end of 15 minutes, following the nursing and collaborative interventions. All right, so why do we say nursing and collaborative? Because the nurse, though the nurse can practice independent, the nurse does need to be collaborative with the other members of the health team, because the nurse cannot write a prescription, or when it comes down to certain areas of specialty that the nurse will need to help to achieve that goal. So we're collaborating, all right? So at the end of 15 minutes, following nursing collaborative intervention, the patient will verbalize a decrease in pain. So you can say it's evidenced by the patient verbalizing that the pain is a 2 out of 10, or the patient will exhibit a decrease in pain. All right, what we're going to use to measure that, there's no facial grimace, nor is no tension in the muscle, and the patient is verbalizing that the pain is a 2 out of 10, whereby initially it was an 8 out of 10. So we want it to be measurable. We want to be able to measure. So the measurement is really stating the degree to which we want the goal to be achieved. So that's really what that M is. That's really what that measurement is. The degree to which we want the goal to be achieved, that's really where we find this measurement. All right. And in other goal setting, for example, later on when we talk about, setting a teaching plan and we are setting up goals, we will find that the measurableness or the measurability is going to fall in those objectives that comes with it. All right. So we want to be measured. So it should be able to be. So we want it to be specific and we want it to be measurable. We should be able to measure it. And then the A is that we want our goal to be attainable. All right. We want it to be able to attain. All right. And so attainable means that it can be attained. So example, you have a patient coming on the unit, and the patient has a history of failure to thrive, and that's related to the ineffective absorption of nutrients, and evidenced by, of course, the patient is like 30-40% below ideal body weight, and all of these things presenting that the patient is really has lost a lot of weight, looking emaciated and all of that. So now, the obviously, because it's a failure to thrive and it's a problem with nutritional absorption, we now talking about a nutritional need. All right. So therefore, our goal now. So if one were to state that the patient will attain 90% of ideal body weight within 3 days, that's not attainable. All right, that's actually not attainable. So you want to be able to write your goal when you're making it smart. You want to make sure that it is attainable. Can this be attained? Can it be achieved within the time frame that you're putting it in? So your goal, of course, has the A, smart. So the A there, attainable. Can it be attainable? Can it happen? All right. And this attainability now also speaks to thinking about the long-term and the short-term goal also, right? Because the attainability will go with the T2. And when we talk about the T, we will see that the attainability is also tied with the T. Okay. So now the R is standing for realistic. All right. So it must be real, realistic. All right. So realistic. We want it to be realistic. So realistic, we want it to be realistic. All right, so it must be specific. We want it to be M, measurable. We want it to be A, attainable, and we want it to be R. We want it to be realistic. All right, so we set realistic goals, and realistic goals. So the attainability and the realistic aspect of it, as well as the T, which is the time, they usually tie in. How? Because you think about whether your goal is short term or long term. Let's say we have a patient and the patient suffered, let's say disturbed body image. Disturbed body image because the patient had extensive third-degree burns. So with that, we know there come the scarring, cicatrice. There's going to be spasticity and all of that happens to the patient, of course, and then the disfigurement and all of that. Now, if one were to set a goal and say that, all right, within 3 months, the patient will be at a pre-burn state. No, there's no way that's realistic, right? Having gone through an extensive third-degree burn, and you say within 3 months, a pre-burn state. No, even if you get the best surgeons, as in the best, plastic surgeons, cosmetic surgeons, they still can't achieve that within 3 months. So when we talk about realistic, right? We think about the time frame. We think about what is happening to the patient, the degree of the problem presented, the alteration in the system. We consider the system and how the system functions. Because let's say the patient was in a motor vehicle accident. So there is spinal cord injury. There was probably fracture of some vertebrae, and then, the spinal cord got injured. And so the patient now has loss of both motor and sensory nerve in the lower extremities, not able to move them and all of that. All right, yes, we do know that some nerve, they do regenerate or heal themselves by what we refer to as Wallerian regeneration, but not all nerves do that. So if we have, say an extensive spinal cord damage, it would be unrealistic that, to say that within 3 months that this patient is going to be able to be walking at a pre-injury state. Not realistic. So we want to make sure that our goal is realistic and then timely. So timely, all right, so there must be time that is part of it. So we think about the time. Now the time, the nature of the problem helps to determine the time frame that we are looking at. Usually, if we have oxygenation issues, those we want to be resolved in the quickest possible time, because oxygen is the fuel, that keeps all the cells and everything up and running. And so if it is a perfusion issue, a circulation issue, all of these airway issue, that we want to resolve as quickly as possible. And so the shortest possible time that can be achieved is we want to do that. All right, if we see that complications will arise depending on the present the problem presented or the system that the alteration is in, we also take that into consideration where we're thinking about the time. Now, if you are doing an exam, let's say, for example, let's take the students in the Caribbean countries that has to do the span, with the span of duty, which is a practical assessment of the nurse that they do before they sit the written exam in October. Let's take those students for example. And let's say that they have that exam to do, and that's like, say, 4 hours that the exam is, should be done in. So what that is really saying, if that such a student is going to be setting up the care plan for the patients that they have been assigned, or he or she has been assigned, and they're writing some goals, because the exam is probably, say, 4 hours, you want those goals to be realistic within that time frame. Not to say that because nursing care continues, so the goal might have to be further, because another nurse is going to come, is going to take the chart, look at the care plan, see what it was, and to see whether or not those were achieved. But bear in mind, when you set up your time on your nursing care plan, when you write your goal, all right, or set your outcome, you want a time there that is attainable and a realistic time, but there must be time. So when we talk about a goal, all right, so SMART goal. All right, so specificity must be in the goal that you're setting. And it doesn't have to follow, a certain set of words starting, here. Because you can say, let's say, for example, you say at the end of 45 minutes, all right, or, so that, or you can say the patient, the family, or the community members will do this or will do that. Now, remember, when you're setting a goal, you're not just collaborating with the colleagues or the members of the health team, you're also collaborating with the client. Because remember, it is the client that you're working with. And, it is often said that the client is the most important member of the healthcare team. Why? Because if you have no client, you really have nobody to take care of. So you always have to bear that in mind. So we talk about goals and goal setting. All right, we want our goals to be smart, guys. All right, so this is what you're saying. So usually you'll find that it's specifying a piece of the problem, it's giving us time, it's measurable, it's attainable, and it's a realistic thing that we're writing or that we're setting. That's what we want, and we want that to be, so that when we finish writing that, that's important. So when we talk about planning in the nursing process, that's what the P there is for. We're talking about goal setting, we're talking about outcome. And so we set these goals and we look at the outcome based on the problems. All right, so we look at these outcomes, so we look at it based on the problems that is presented or that the patient presents with. So we look at it based on that. And now when we talk about how then do we use this planning in other areas. So let's say, for example, you are an in-service educator. All right. So as an in-service educator and you're using the nursing process to, do your in-service education. But first of all, you have to do the other components first before you can plan. In other words, before you can set goal, before we can have an outcome, right? So we have to do the other processes first. So assessment and of course diagnosing. How does the in-service educator assess? Let's say the in-service educator notices that there are a number of incident reports coming about falls or other injuries, and these are really preventable injuries. So the in-service educator use those incident reports as part of his or her data gathering tool. All right. Let's say we have those reports on medication errors, on falls, and other things. All right. So using that as a data gathering tool will part of gathering the data, which is assessment, observation, observing the nurses and other colleagues as how they carry out their duties and all of that. And then based on all of this information gathered, now the in-service educator, of course, now can do the diagnose the problem. All right. And diagnosing the problem is coming up with a problem statement or identifying the problem. Because what you will realize is that the nursing process mirrors the problem solving process, because we use the nursing process to really problem solve. So, when you talk about identifying the problem, and, as in gathering the data and the information to identify the problem. Once we identify the problem and, we see what the problem is. And then, of course, we're going to be exploring the options. Exploring the options is really like putting your diagnostic cluster together to see that which is the major thing that we want to take care of. And then, of course, we are going to implement those results, and then we are going to evaluate the results. That is the problem solving process that I just told you right there. Now, if you look at the nursing process, it mirrors the problem solving process, and that's why we use the nursing process to problem solve as nurses on a day-to-day basis in every area, and so this is really what it is all about. So in using the planning, of course, in-service educator, and then the in-service educator now setting the goal. So the goal now is usually written on a teaching plan, because usually in-service educators in the classroom, educators on the unit, and educators in the lab with the students, usually when you're writing the goal, now when you write the goal, specific to, all right, at the end of the workshop, at the end of 15 minutes, at the end of so and so, you will be so you want to be specific about what it is that you're writing, and then measurable, and then attainable, and you want to make sure it's realistic, and you want to make sure that it is really timely. All right, so timing is in it. So now when we write a goal to do a teaching plan for our patient, whether we're doing a discharge plan, and remember that discharge planning begins from the moment the patient is admitted to the facility, or from the moment you actually get the pre-interaction with the patient and in the orientation phase of the nurse-patient relationship, the working phase, and of course the termination phase. So discharge planning does not begin in the termination phase, actually begins the pre-interaction phase. From the time we meet the patient, that's the time that discharge teaching or discharge planning begins, and so you start to put together what it is that you're doing. So when we're writing a goal for teaching the patient, let's say that it was a psychological need, and we came up with something under deficient knowledge, or we came up with something under a wellness diagnosis or a health promotion diagnosis that talks about readiness for enhanced well-being or so. Then, of course, when you write that goal, or when we write those goals, what is measurable in that is that the objectives come out. So when we write the goal and we say, all right, at the end of the 45-minute teaching session, the student or the patient or the family or the community will be able to, and you specify what it is that you want to use as measurement. So now we see how that goal is written, and so we see how that measurement comes out. Now, here is something that is smart. When you are writing a goal for a patient education session, a family education session, community education, or an in-service education session, all right, when we're writing our goal here, to be smart about that goal, the objectives you want to be measurable. All right, now it is always good to put an objective per domain. It is always good. And what domain am I talking about? We're talking about the domains now on Bloom's taxonomy. So we talk about the cognitive domain, which is also called the thinking domain. And then we're talking about the affective domain, which is the feeling domain, and the psychomotor domain, which is doing things. So if you're writing a goal, it's good to write something to measure under the cognitive domain. All right, the patient will be able to identify, able to state, able to repeat, all of this, see knowledge and understanding or comprehension. Under the affective domain is really showing how the client feels about the situation at hand. So let's say it's an ostomy. The client will demonstrate an acceptance of the ostomy. That's affective. All right, the client will accurately demonstrate the changing of the ostomy apparatus. So it's always good to put your goals under, at least one goal under each domain if you're not doing a long one, or at least more than one under the domains. That way you're able to test to see, and to measure. Now, when you write your objectives under that goal statement or outcome statement, one of the things with the objectives is that you also want to be specific in the objective, and the objective should say the degree to which you want the task to be done. So measurability, the patient will be able to accurately return demonstrate. So you put things in there like those things like accurate demonstration and that. So all of that there. So that's how, you do that. Now, when you're doing your teaching plan, if it's 45 minutes, you want to break down the time under each objectives and how long you're going to take to do that, and what is the content that you're going to do, and then what is it that you're going to use to measure to see whether or not you meet that. So that's how you do that, guys. Now, when we're using the planning, that's the P in ADPI, on the unit as, say, a unit manager. Let's say you are the charge nurse for today. How do you use that P, that plan, that goal, that outcome? So you also gather your information in terms of the assessment first, and then diagnose, then you plan. What's the information you're gathering? How many staff do you have? What is in terms of the skill set of the staff? How many patients do you have? What's the patient acuity and the patient number? And do you have the skill set to do that? What material do you have to work with? You do that. Then you come up with a problem. So you have shortage of staff today, or you don't have the requisite skill set that you need for the patient acuity. You want to bear that in mind. And then now, of course, you want to plan, set the goal. So the outcome will be that at the end of the 12 hours, the nurses will complete all the tasks, complete the assignment. This will be done, that will be done. So that is how we use that P. So remember now that under management, you do have the components of management. Planning is one of those, and that planning is also equal to the P in the P in ADPI. So this is the things that we do, guys, when it comes on to goal setting and how we manage this, and this is how we do it. All right, so the next time we're going to be talking about implementation and evaluation. All right, so don't forget to subscribe, click like, leave your comments. Don't forget to share these videos. All right, this is Nursing Practice Made Easy, breaking it simple down for you so it's easy to apply. All right, I'll see you next time.